Hi, Dr. Curtis here from Longview Spine and Sports Medicine. So people wonder very often if chiropractic could be a possible way of dealing with a knee problem. Most people think, of course, of chiropractic as a way of handling spine problems. But the truth is that we can certainly adjust knees just as well, and as much as we can adjust the spine. There are three main issues that tend to cause knee problems. It could be something wrong with the knee itself, as far as some sort of structural misalignment of the knee. But it actually can be something stemming from either the foot or from the pelvis as well. So very often, because people will like to sit with their legs crossed, they'll create a bit of rotation or a twist in their pelvis. And if the pelvis twists, then that very often now will turn the legs so that the feet point off to the side. And you can't walk around with your feet pointing in a different direction than the rest of you. So you have to compensate lower down. When your pelvis is pointed off center a little bit to get the feet pointed back in the right direction, you'll compensate in your knee. The knee is designed to bend but not twist. So when you put any twist into the knee, it tends to cause a lot of pain very, very quickly, and you can work on the knee without getting very much success. But if you instead work up on the pelvis, the knee gets better. So we see great results with knee problems by taking care of any rotation in the pelvis. But you do also find that knee problems can come as a result from something wrong in the foot. Very often over the years, because of either sprained ankles or bad choices of footwear, such as flip-flops or high heels, the arches of the foot begin to collapse. There are actually 3 arches in each foot. Everybody knows about the big one on the inside of the foot. There's also a smaller one on the outside of the foot, and there's one that goes across right at the ball of the foot. As these 3 arches begin to collapse, the foot has a tendency to roll either in or it might roll out. It's what we call pronation or supination. So pronation is rolling in, supination is rolling out. Well, when that happens, that's going to create either a knock-kneed or a bow-legged problem in the knees, and that's really stemming from a problem in the foot. So in order to really understand what is causing somebody's knee problem, we would tend to take a look not only at the knee, but we would look at their pelvis. We would look at their ankle as well, just to see where the problem is really originating from. That's kind of a holistic approach. I think this is key for having a really successful outcome and dealing with a knee problem. Whereas most of the time, if you were to go to an orthopedist and have them take a look, they're going to focus predominantly just on the knee. They'll order an x-ray of the knee. If that doesn't show any problems, then they'll get an MRI of the knee. And then let's try steroid injections in the knee and things like that. Rather than saying, well, let's take a look at the mechanics of the foot. Let's take a look at the mechanics of the pelvis as a whole, what we call kinematic chain. Kinematic chain means all of the joints are in a particular path of movement. So everything from the toes all the way up to the pelvis. That's all one kinematic chain. Everything from the joints in your fingers all the way up your shoulder is another kinematic chain. Of course, your spine is one long kinematic chain as well. So if you've been dealing with knee problems, know that chiropractic might very well be the best possible solution for you. And we get very good results with knee issues. Not all chiropractors, though, work on things other than the spine. Most chiropractors will do things with extremities, meaning leg or arm problems, but not all do. So it's important that you check with your particular chiropractor that you're considering going to, whether they focus on spine exclusively or whether they also work on extremities. Thanks for listening.